Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. You're listening to episode 71 of the podcast for August 10th, 2009. This was recorded actually late last year in 2008, but it's a continuation of episode 53, our discussion with Patrick M. Anderson, the executive director of Chugatchmiut, which is a tribal consortium created to promote self-determination to the 7 native communities of the Chugach region in Alaska. So among other things, they provide healthcare services, which is the focus of our discussion here, use of lean thinking and culture in both the administrative and care delivery processes. So today, Patrick will talk a lot about culture of an organization and values, how lean fits in with that, and how that helps them improve their delivery of patient care. So as always, I want to thank you for listening.
Okay, final question. Talking about culture and management system and the progress that the organization's made. How do you characterize progress in terms of results, or how would you measure the results that you've had so far with Lean in the 4 years, and what kind of results would you expect in the future, either in regards to the patient care, employees, the organization itself?
That's the toughest question to answer, and probably I would think in my faculty days would take 4 or 5 sessions to teach, Mark. So I'm going to try and be brief enough, but sure, expansive enough to convey my learning on that part of what you asked for. Uh-huh. The biggest problem one has is employee resistance. In most organizations, when you come into the job, you're not oriented. A lot of times I've come into a job and they don't have a desk for me. It takes 2, 3, 4, 5 days to find a place for me to be, and then finally they'll maybe orient me to benefits. And then you're expected to learn the job on your own because there are no systems defined, and no one can break out the standard work and begin explaining how you fit in and what your role is, and here's how you do things. That was the biggest problem that I had. Chugatchmiut was built upon individual effort and motivating people to perform individually at their highest levels. But what that meant is that they weren't looking for opportunities to cooperate in processes with other people. They just wanted to make sure that when that work came into their hands, when it left their hands, it had their highest individual quality of work possible. They didn't know or understand or care that the whole end result of that may well have been to add to the number of defects and the amount of time it took for that process to happen.
Sure.
I had what I've learned are referred to in the trade as concrete heads.
Right.
People who will tell you all kinds of wonderful things to your face, but not make any attempt to understand. Basically, if you figure that the average tenure of a CEO is probably 4 or 5 years, we'll outlast this one.
Yeah.
And we'll just keep doing things the way we're doing things. Well, I came out of a successful law career. I made a transition into nonprofit management because of a couple of nonprofit issues that I wanted to try and see the world or the United States deal with those issues, and particularly fatherhood, restoring responsible fathers back into the lives of their children, and healthy relationships. As a divorced father, I understand that there are ways to make relationships healthy. So I came into nonprofit management with a mission, and that mission had to focus on the people that we served. Well, that's a big change in and of itself. So I have employees who are comfortable doing things the way they've always done them. They do respond when you go in and exhort them for a little period of time, but then they outweight the managers and that they back into what they were doing beforehand.
Right.
And then, of course, without any transparency in the organization, you never know really where the defects occur. And that's a common problem in all non-lean organizations. Well, I did a couple of things that have taken a long time to filter through the organization. The first is to have a sense of values, to have a corporate-wide culture of ethics, of morality, of how you should participate in a social sense in the governance of your community. And then values, individual values, I'm paid for a 7.5-hour workday that starts at 8:30 and ends at 5. My personal sense of values tells me that I'm going to give a full day's worth of work for that full day's worth of pay. That I'm going to be honest in how I use company resources, that I'm going to be honest in how I interact with the people that we deal with, and most important, how we are going to work to benefit the people that we're here to serve. Getting that customer focus. It meant I had to display that day in, day out. It meant that I had to speak about it frequently, and we had to write it into our policies and our procedures, and most of all, emphasize it any time we dealt with value streams, that at some point the customer enters our stream of service, and at some point they exit, and in between you need to make sure that the service that they're getting is the absolute best we can give. Not the absolute best, because otherwise you have no room for continuous improvement, but the absolute best that we can give. And then when we discover defects, we're going to improve that service even more. Those were difficult lessons, but we proceeded with them as we began to do the analysis of the workplace. And in administrative lean, there are, in 2004, were darn few examples we could look to. The manufacturing industry, even I, just sitting on the board of the plastics plant, I can walk into a factory, into a plant, and immediately see the waste or the muda that exists. And I can probably go in and lead a pretty competent Kaizen and have some decent results by the end of the week. In administrative lean, a lot of what you see is transparent.
Right.
I mean, not transparent. It's invisible. A lot of things that happen, you actually have to take out the stopwatch. You have to sort of break out the Post-it pad, and you have to follow that. But you can't do it usually because lots of times the value stream can be, like I mentioned with our hiring processes, 144 days long.
Yeah.
So you find a lot of inboxes that you have to look at, and a lot of other work that those individuals are doing because of their intersection with a whole bunch of value streams. It's complex.
Sure.
So we didn't learn a lot of that up front, but we still managed to conduct a number of Kaizen. And what it told us fairly immediately is that most of our systems were really bad. Our document management system, the absolute lifeblood of everything we do as government contractors, was severely broken. You asked about measurement. We didn't know how to measure an administrative environment other than by individual isolated parts of it. When we started our document management system, we did take measurements of the amount of paper that we had in the organization, which was a lot, but we didn't measure the amount of wasted time that came in looking for lost documents, recreating lost documents, or in transporting those documents. I sure wish I could go back and do that measurement. But I realize now that I couldn't to begin with because we were so poorly run. We were fighting fires all the time, and I didn't have enough staff time
Sure.
to really do those measurements. So we started a central records management system, and it was a godsend because we began learning about the transport part, about the accessibility part, about one-piece flow and making sure the documents were there when you needed them. And it also stretched our strategic vision, and we began to realize that with the improvements that we were making, even having paper documents was waste. Mm-hmm. We're poised right now through selection of a new finance and accounting enterprise resource platform to go digital for all of our finance records, and then all of the other records beyond that, it's very easy to scan and to store digitally. So in about 6 months, we should be a completely paperless office, and the changes in that are just incredible. The elimination of our accounting staff having to track down signers for checks is just, it's basically going to be days and days of savings every month. Yeah. Same thing with our IT. Most companies don't want to invest in IT, but we changed our thinking to realize that IT is a tool. And if people don't have good equipment, it can cost a lot of waste. The example that I used at the Lean Healthcare Conference in Nashville had to do with my HR manager. The little example I cited of just the amount of time it took her to save documents in an antiquated system using fully depreciated equipment was 2.5 days for one employee every year. And I had 60 employees at the time, probably 45 or 50 of them who had to save. So that's practically a man-year worth of labor. Mm-hmm. What we found, Mark, is that after our first year, we had freed up enough time for us to begin to dedicate more effort to some of the strategic initiatives that also paid back the investment in increased productivity and increased service to our customers and our clients. Yeah. And we had some real doozies for issues, including resistance of my healthcare team to some of the improvements. I had 5 mid-level practitioners quit on me, and it took a year for us to replace them in a reorganization, and that's stressful, particularly on my human resource staff. But as the changes have come into place, what we're finding is that we're focusing on our customers. We're providing more services. We have a communication strategy right now that's driven by a wellness and prevention program. My staff, in fact, the reason I told you that I had to wait until this period of time is that my staff in the healthcare division is now working on a planned care strategy with the Indian Health Service, and we have a weekly teleconference where we discuss some of the techniques that have been tried, and we then are able to devise our own experiment on how that can fit into our practice. Uh-huh. We have the resources now to actually fund the research, committee work, and training and implementation of an electronic health record. Our grant writing has improved so much that right now what we're doing is we have a pretty significant grant to implement a more aggressive telemedicine system that will integrate behavioral health. And the work that we did qualified us for being one of the key partners for the University of Washington in a depression screening protocol that has been tested in non-Indian country, but is now being tested through Chugatchmiut in Indian country. Uh-huh. But we're going to bring screening for depressive and anxiety issues into our primary care center. We're going to be able to structure a brief intervention, and hopefully that will help improve the quality of life of our patient. Some of the results that we heard out of the screenings that have been done in non-Indian country are that some patients with chronic conditions have reduced the days that they have suffered debilitating depression by as much as 100 days a year.
Oh.
So we're thinking futuristically.
Mm-hmm.
And we have the time to address and to research and to study and to participate in a lot of initiatives because we're not fighting the fires that we fought before lean came into our corporate existence.
Yeah. So it sounds like you're taking a really good long-term view and systemic view of not just measuring short-term results of existing measures, existing processes, but really taking a look at, it sounds like freeing up time, freeing up capability to provide better care and preventive medicine. Did I summarize that?
You summarized it very well. Not only are we looking within our own system, but Toyota has paid extreme attention to its supply chain. And as I mentioned early in this discussion, we rely on the Alaska Native Medical Center and the South Central Foundation for a lot of our services. I, about 2.5 years ago, started advocating for the Alaska Native Tribal Health System to begin using process management, in particular lean healthcare, and we're getting some traction. You'll probably recall the discussion about St. Joseph's Hospital in West Virginia and the fact that they were able to double the amount of time that their nurses were able to spend with patients just in a 1-week Kaizen. I use that example with the CEO of the Alaska Native Tribal Health Consortium. I've been leaning on him for quite a while to begin a process of converting the tribal health system management to a lean management style. And he is familiar with the Institute for Healthcare Improvements initiatives on lean, although I think he has a lot to learn, but he's willing to learn. And I think our system is going to work, but that comes out of my staff doing the work and freeing me up to be able to be involved in the greater statewide tribal healthcare system and to begin to advocate for adoption of lean management methods within the institutions that we have to deal with. I'm excited. I'm really excited. I think the trend is happening in Alaska.
Well, that's great to hear, and it is exciting, and it sounds like that time that you're freeing up by not giving people the answers and dictating solutions to people. I'm guessing that's a lot of the time that's freed up for you to work on these more strategic, wide-ranging initiatives.
That and mediating arguments and disputes among staff based on their political perceptions. When we went to a fact-based, non-judgmental, no-blame, no-shame environment, the politics steps out of the equation, and we're now focused on what serves the patient, what is scientific, what can we prove. We have a long way to go in measuring performance, but like I said, we don't have many examples in administrative lean. We do have some in lean healthcare, but a lot of those are hospital-related, which don't really fit our clinics. But we're also realizing that while we need to be knowledgeable of the day-to-day process management, the big gains in healthcare are going to come from our children if we can educate them on how to build a stress-free life, how to deal with behavioral health issues early on, proper nutrition, and good exercise. The healthcare system will be incredibly transformed in 15, 20, 30 years when those individuals start hitting the healthcare system. And in the meantime, we need to figure out how best to help our chronic care patients learn about their issues and then to adopt some of the same solutions. Good diet, exercise, good hydration, reduction of stress, all dealing with their behavioral health issues, and their quality of life will go up. So those are the measures that we're finding now become really important to us, Mark, not necessarily the day-to-day process improvements, which are becoming second nature for us to document.
Well, Patrick, I can't thank you enough for taking time out to talk with me and the listeners. I really really glad I had the chance to meet you at the Productivity Inc. conference, and that you're willing to share your story and your progress there in Alaska.
Well, I view this as a mission, Mark. There are patients out there who are dying needlessly because of a system in which we have fantastic, well-trained, well-meaning people, but working in very bad processes.
Yeah.
And I've just seen how much working on process management can improve the ability of an organization to meet the needs of patients. That I feel that probably like you do, I have to preach that particular gospel because people are dying.
Yeah.
When they don't have to.
That's very true. And so, good luck with your continued efforts. And I'm sure your words and thoughts here have inspired some others to take action. And I really appreciate you taking the time.
I certainly hope so.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.